Wominjaka and welcome, Rhea. It's great to say hi to you from the land of the Wurundjeri people of the Kulin Nation. I thank you for your time and sharing a bit of your thoughts with us today. Before we start, can we just get to know you a little bit more? Would you tell us and introduce yourself to us?
Well, I'd like to start by acknowledging the Yugambeh-speaking people of the land where I am, which is on the Gold Coast of Australia, where I'm a general and breast surgeon. And I still consider that my main job, but I'm also the surgical lead at Bond University on the Gold Coast. And I'm the immediate past chair of the Operate with Respect Education Committee for the College of Surgeons.
Sounds like you've got a lot on your plate, Rhea. You have done a lot of research and work around teamwork and team building in healthcare. And as a surgeon, you probably see a lot of teams, and you see teams that work well and you see teams that don't work too well. Can you tell us about the state of teams in our healthcare industry? And are we as good as we need to be for our patients? What are the things that we are doing well, and what are the things that we are not doing as well as we should, Rhea?
Well, the thing about it is there's a lot of variety in ways of team working, and we all work in different environments and different workflows. So what would work as a really good team in the operating theatre, for example, might not work so well in perhaps the emergency department or on a psychiatric ward or in the community. So it's not so much a checklist of do's and don'ts. You know, it's quite common these days to see someone put up a little checklist and say, you know, signs of good teamwork or signs of poor teamwork. But it's more complex than that, because it's more about the underlying culture. So any of us who enter a new team or a new workplace, within the first few minutes or hours, you'll already have figured out what the culture of that place is and how you fit in. And that's not because anyone sits down and says, now this is the way it works in this team. It's all the little verbal and non-verbal cues that you bring into it. So really, ideally, what we should strive for is, of course, an affirmative and safe learning culture. And it's the little things we can do to establish that. So it doesn't matter where you are, you know, if you see someone who's new or someone who looks uncertain, go over, introduce yourselves. I mean, it's an issue of patient safety, of course, to make sure that they actually belong there and that they're not someone who accidentally got lost, you know, from outside the unit. So that's kind of where teamwork theory is heading now, not so much a list of behaviours, but more about the culture and the attitude in that team.
That's amazing. So you've already talked about complexities, you've talked about the culture or the hidden way of how we treat others in our team. What should we be striving for? What's the ideal? What does an ideal team look like for you?
Well, people say, oh, it's very simple. Everyone just has to be nice. Now, there's a really interesting body of work that shows that what we call nice culture can be as damaging as nasty culture. So obviously, none of us want the nasty cultures, the ones where we've got bullying, harassment, overt conflict behaviours. But there are teams where the emphasis on being nice and getting along with everyone is so emphasised that actually no one wants to speak up. No one wants to disagree. No one wants to be the person who makes a fuss or rocks the boat. So actually, when we talk about ideal teams now, we're thinking about psychological safety. And the best marker of psychological safety is the safety to disagree. How safe do you feel disagreeing? Can you say, actually, I disagree? And even though you might not necessarily have everyone agree to implement whatever you're suggesting, the point is you'll be listened to considerately and your suggestions considered thoughtfully. So that's psychological safety. It's neither nasty and it's not superficially nice either. It's actually, you know, that tolerance of lots of diverse points of view, and being able to understand that you can't get your way all the time, but you understand that whatever happens has considered everyone's points of view and therefore has made the best decision for the whole team.
That's a fascinating and fantastic and almost a really accurate thing, isn't it? To go from just being nice to each other, but going beyond that to actually be safe, to be psychologically safe for the whole team. And of course, when we talk about team, we talk about it in the context of caring for our patients. You know, that's a big issue stuff. You know, the ultimate goal is caring for our patients. So with those ideals in mind, what are the steps that, you know, institutions, departments, hospitals or craft groups do to improve our team work and our care for our patients?
Well, I think the most pressing thing for all organizations is getting diversity. And a lot of organizations are already doing very well at getting diversity on the shop floor, so to speak. But where we're missing it really now is heading into the leadership levels. So often you'll find that there's a very diverse workforce, but a relative lack of diversity amongst leadership levels. So we can do better at that. When I talk about diversity, I mean it in a very broad sense. So I'm not just talking about different skin colors and different languages and different races. I mean, we should just take that sort of thing for granted in 2021. But we're really talking about a much broader range of diversities in the way we think. So you and I, for example, might both have an Asian background, but we've had very different paths to arrive here in Australia. And actually, we may think in very similar ways because we're both medically trained, but there may be people in nursing streams or in leadership streams or admin streams who look exactly like we do in terms of being Asian, but think in very different ways because they also have had very different paths to get here. So that, I think, is the biggest institutional thing, to get beyond visible diversity, because everyone's busy getting, you know, a woman onto the committee or an Indigenous person to be in each space. But it's like, that's a very superficial way of thinking about it. We need to build in a lot more thought diversity and diversity of different pathways and backgrounds to really bring as many different thoughts to the table as we can, because that's what really strengthens an organization.
I mean, those are really powerful stuff. The psychological safety, the cultural safety, the thought diversity beyond just skin color diversity. So those are the big picture stuff. But what about someone like me who does not hold, you know, any significant board membership or anything like that? What if I don't have a position of power to make changes? What can a simple person like me who's part of a healthcare team, what can I do as an individual to actually improve or influence that diversity and inclusivity in our teams?
Well, in a funny way, this interview has gone full circle because it gets back to what I was saying about the small actions. The culture is not established by policy. So all of us work in organizations that have various no tolerance policies, no tolerance for bullying, no tolerance for verbal abuse, that sort of thing. But we know that that actually goes on a daily basis. And sometimes we have to walk past it in order to get our job done. You know, you might have someone who's very disruptive as a patient, but you have to put up a little bit with their verbal aggression in order to deliver healthcare that they actually need. And that can be a difficult balance. So that's the policy, but the actual culture of the team is set by all the little things we do. And it gets back to what I was saying about it's as simple as noticing people, you know, welcoming them, the little actions. And I think the best way to think about that is to think for yourself when you are feeling uncertain or out of place, what made you feel like you really belong? And it's almost always someone doing something small.
That's true.
For you. And so you can be that person for someone else. You know, it doesn't matter what level we are or where we are, you can be that person who makes someone else feel welcome and sets the culture for that person. So to make them feel, oh, I belong here and I've got something to contribute.
That's fantastic, Rhea. I appreciate that. So I don't have to wait for someone with big positions to write a good policy or anything like that. As good as policies are, you know, and as important as they are, sometimes it's the people that we rub shoulders with that matters, and it's that wave from below, top down, bottom up, or whichever way you want to look at it. Is that correct? Any big messages, takeaway messages for us who all work in teams for the betterment of our patients? Any big messages?
Well, we've all been through quite a tough time that's lasted almost 2 years now. And people will say, you know, just be kind, smiles are free, kindness is free. I'll tell you, it's not actually free. It can take a lot of emotional labor every day, particularly when you're working in very resource-stretched environments. It's much easier to lose your temper, stamp your feet, be grumpy. You know, that's actually the easier path. It takes superhuman effort sometimes to continue to be kind. So kindness is not free. But I would say we can't all be superhuman. And so if you find that your capacity for being kind to others is decreasing, that's probably your sign that it's time to turn that kindness inwards and to practice some self-care. That is the time that you actually need to go home, sit on the couch and watch absolute rubbish, eat chocolate, have a hot bath, play with the kids, or whatever it is that fulfills you. Try not to continue being grumpy at work, because that's often a sign that you need to be kinder to yourself.
Thank you so much for your time, Rhea. So I'm catching this. So self-care is not self-indulgence.
Nope.
Self-care is about caring and giving for our team members,
yes,
who are also ultimately going to determine the safety of our patients, because we do want to give the best to our patients. We want to provide the best team environment for our patients. Thank you so much again for your time. And from the team at Gathering of Kindness, we appreciate your thoughts and your time. Thank you again, Rhea.
It's my pleasure, Eric.
Take care.